Let's say someone you care about is in the hospital. You're hearing all this medical jargon, and then someone brings up the chaplain. Now, for a lot of us, that word conjures up a very specific and often pretty inaccurate image. So today, we're going to pull back the curtain and take a look at what hospital chaplaincy is really all about.
And to really get to the heart of it, we're going to walk through a hypothetical situation. Now, this isn't a real case, but it's a perfect example of a very common misunderstanding about the role a hospital chaplain plays and the kind of support they actually offer.
So here's the scene. You've got a 34-year-old guy who gets admitted for some pretty bad abdominal pain. After a few tests, they find a pelvic mass. Now, he's awake, he's alert, and he seems to be handling the pain okay. But you can imagine there's that big question mark hanging in the air about what happens next.
His sister is there, and she's just trying to be supportive, so she suggests, hey, maybe we should call the hospital chaplain. But his answer is quick, and it's a hard no. No real need exists, as my case is not that serious. And boom, right there, that is the exact misconception we're here to talk about.
You can see how this puts his sister in a really tough position, right? She's trying to help, but he's shutting her down because of this idea he has in his head. So it leaves her with this really difficult question: what's the right thing to do now?
And this is really the core question for us today. I mean, given that he just shot down the idea, should his sister go against his wishes and contact the chaplaincy anyway? Well, to answer that, we first have to really understand what this service is actually for.
And here's the problem in a nutshell. You see the patient's view on one side. My case isn't that serious. He thinks chaplains are only for the most extreme, end-of-life situations. But then you look at the broader perspective, the reality. Chaplaincy is there for any admitted patient. That's not a small gap in understanding, that's a huge one.
So how do we bridge that gap? We do it by looking at the actual mission of chaplaincy. Turns out it's a service that's built on 4 main goals, and they show a purpose that is so much bigger than just swooping in during a crisis.
So here they are, the 4 pillars of their work: to heal, to sustain, to guide, and to reconcile. And when you look at them all together, they paint this really complete picture of what holistic support looks like. And it all starts with a much bigger idea of what it means to heal.
First up, healing. And listen, we're not just talking about the physical body here. This goes so much deeper. Chaplaincy is there to help with the whole person, and that includes all those ethical and spiritual questions that pop up when your health is on the line. It's really about helping find a little bit of peace of mind, which, as we know, is a massive part of recovery.
Next, we have sustaining. And this is a really delicate job. Chaplains have special training to help patients work through and come to terms with their illness, with suffering, and yeah, sometimes even with mortality. This isn't about giving up hope, not at all. It's about finding that inner strength to navigate the road ahead, whatever it may hold.
Okay, then there's guiding. And I find this perspective really fascinating. Instead of just seeing an illness as something terrible, chaplaincy also sees it as a potential moment for real, genuine change. It can be a time to kind of hit the pause button, reflect on where your life is headed, and maybe start to focus on what really matters.
And the 4th and final aim is reconciling. You know, a health crisis has a way of putting everything into sharp focus. It can be this powerful moment to mend broken relationships, whether that's with a higher power or maybe with family members or friends you've lost touch with. A chaplain can provide that safe, neutral ground to help that happen, if that's what the patient wants.
So those 4 aims tell us what chaplaincy is all about, but the how they actually do their work, is just as important. Their entire approach is built on a foundation of respect, which makes it a resource for absolutely everyone, no matter what they believe.
And their method is actually pretty simple. They'll approach patients from any and every background. Doesn't matter your religion or your belief system. It's never about pushing an agenda. It's always about offering support. A lot of times, it just starts with a simple question, like, hey, would you like to chat? And this is key. The support is also there for the family, and they even help prepare everyone for what life looks like after the hospital.
Okay, so now that we've got this much clearer picture of what chaplaincy is, this whole support system, let's circle all the way back to our original question. What about the sister in our story? What should she do now?
Well, the best path forward is a gentle one. Perhaps his sister could just try to explain a little of what we've talked about. That chaplains aren't just for the most serious cases, but are there for any patient who needs a little extra support. The goal isn't to force him into anything, but just to encourage him to be open, to maybe, just maybe, having a quick chat.
At the end of the day, chaplaincy is a resource that offers a kind of support that medicine alone just can't. And it leaves us with this one big, important question to think about. What does support truly look like when someone is sick? As we've seen, it's about caring for the whole person, body, mind, and spirit.